There's no question that the health system is working under pressure. And I want to start off by just thanking all of the frontline staff, the doctors, the nurses and all of the staff in the hospitals that make the hospitals work, that are keeping us all safe and looking after patients, as you've just heard from Dr Morgan, patients who can be very, very ill with this virus. But I want to assure the community that we have been working, that is the health system, have been working on this since January, February last year, and making sure that we stepped up the number of available ICU beds, staff to work in those ICU or intensive care units, ventilators. But Westmead Hospital is typical of the sorts of pressures that you'd expect when you've got a major quaternary hospital sitting in the middle of the epicentre of the virus outbreak. I think it sits 3 or 4 kilometres from Granville, quite close to Marylands and the other suburbs that we have been calling out in the last few days. Currently, Westmead staff are managing, I think it's about 1,500 patients in the community, and they've got about 121 staff in their wards. I think there's about 23 of those are currently in ICU, in the intensive care unit. That's certainly a pressured situation for them. The other aspect is they're also now able to work with the private hospitals. This was something that was set up last year by working with the federal government, and last Monday the situation was confirmed here in New South Wales, particularly in Sydney, that beds would be available in our private hospitals. Westmead will obviously work with Westmead Private and other private hospitals in the local area to make sure that some patients are able to be looked after in the private hospital as well. I want to stress, though, that it's not easy. Last week alone, Westmead Hospital had 280 patients who came in by ambulance with COVID. So about 40 ambulance deliveries a day with COVID. And each of those patients are being well cared for. You just heard Dr Morgan talking about the level of care that's required. I'm confident that we have maybe a system that's under pressure, but it's a system that works. We have staff that are doing an incredible job looking after patients. But what I would say is just reinforce the message from Dr Morgan. Please don't be a patient that comes to our hospital in the sense that don't get sick. Can you please go and get vaccinated? If you're thinking still about whether or not a vaccination is a good thing, can I tell you that, as Dr Nguyen said a couple of days ago, it's not a great day when you have to meet the intensive care department of a hospital. So please just go and get vaccinated, and that will help take some of the pressure off our hospital system.
Minister,
one at a time, please. I'll go with Anne.
Minister, can you tell us what the R-effective rate of the virus is at the moment? And I've seen some graphs that show that by the time we get to 70%, we could have up to 4,000, 5,000 people in hospital. Can we cope with that?
Look, the R-effective rate, according to our own public health advice, is about 1.3 at the present time. But it's variable, and of course, like all algorithms, it varies depending on the inputs. And I know that one of the joys of being the health minister is to have all the experts from all the different institutes all feeding in different data and coming out with what they consider the R effective, but certainly at the moment it's about 1.3, which effectively means that for every 10 people who get the virus, they're going to infect another 13 people. So it will grow. But the one way to stop it growing and the one way to stop you ending up in our intensive care unit or in our hospitals is to get the vaccine.
Minister, regarding
sorry, I'll just go to James first and I'll come back to you, Clinton. Sorry?
You didn't answer Anne's question about whether the hospital system can cope with thousands and thousands of cases every day. And further to that, 919 cases a day, an R-effective rate of 1.3, Westmead Hospital is under emergency operations, people are waiting for hours in the back of ambulances. What specifically are you doing to make sure that we can cope when cases continue to climb? Will we look at field hospitals in southwest Sydney?
The issue here is that the health system is world class. New South Wales health system is probably the best health system in the world, and all the information that is given to me from the doctors and nurses and our public health staff is that yes, the system is coping. You've got to understand that the individual hospitals from time to time will be under all sorts of stress, particularly if they're sitting right in the epicentre of the breakout, which is Western Sydney and southwestern Sydney. And it may move to another area, but we're hoping that by people getting vaccinated, we'll actually be able to turn that down.